welcome back. This is the cons to being a dental assistant. Let's get into it. I don't have that much time because I have to go to work. You're probably already thinking it. The number one con about being a dental assistant is the fact that you work in people's mouths. You see some very, very nasty things. I would just insert some pictures from Google Images because technically I couldn't have any pictures of my own because that would be against HIPAA. Number two, this happens to me a lot. If you're really busy at work and, for example, you're in the middle of a really busy procedure or somebody comes in as an emergency for lunch and they decide, okay, we're gonna go through the treatment and start today, then you may not get a lunch. It's happened to me, honestly, a lot. So the advice I would give to that is bring snacks. Have like maybe a box of snacks or like a little assortment of snacks in your locker, maybe some drinks in the fridge, whatever. Just have something to eat because sometimes you don't get lunch. Like, dude, literally sneak those snacks with you to the bathroom and just eat them. Do what you have to do because your health comes first. This is kind of like a given. Some patients literally just hate the dentist. Like, as soon as they walk in, they're like, don't take offense, honey, but I hate this place. And it's like, but why do you hate this place? Is it because you didn't take care of your teeth and that's why you have to come here so often? Or you barely come because you don't take care of your teeth? I'm just wondering. So, I don't know. You deal with some unhappy patients, and this is a common thing in the dental industry. People aren't supposed to do it, but sometimes when you have a patient that is annoying and just in a bad mood, or just everybody looks forward to not seeing them, well, sometimes in the patient chart under the alerts, somebody will write a thing called PITA, P-I-T-A, and that means pain in the, you guessed it, as. So yeah, you'll deal with unhappy patients, and I think you deal with it more in general dentistry where people are adults versus like pediatric dentistry, because most little kids are scared, they just don't know what to expect. Most adults have already been through this a million times, they know what to expect, they're unhappy, they're having to spend their own money too, so that's a big factor. And this is just a random one, but never talk bad about a patient ever. I would even say, honestly, just don't ever talk about a patient in any kind of derogatory or rude way. And I just want to talk about patients at all, unless like the end of the day you're just talking about how things went, but just don't talk about patients. Because when I was in dental assistant story, our teacher told us a story about this chick. She was talking about a patient, she said some really rude, horrible things, and the lady was in the restroom and she heard the dental assistant saying all these things. You can get sued for that. It is called a defamation of character, and you just can't say unfalse things about a patient. You can't be rude, derogatory, and that type of stuff, or else you could get sued. And supposedly that chick got sued for about $20,000. Just don't do it, it's not worth it. And I've worked at practices where like people are just like, ugh. I remember at the first, second or third practice that I worked at, this chick was like talking about a patient, like, I don't want to deal with his old ass. I'm like, oh my god, what if he hears you? I know he's a little old man, but dang, that's rude. So, okay, now we're on to the next one. Number 5. Okay, so this has happened to me a lot. Dentists belittle you. They make you feel dumb. They want to make it seem like they know so much more than you, when in reality, they really don't, honestly. Yeah, you just have to be ready to, you know, be broken down and talk back to and that type of stuff. It's just, it sucks. And then on top of that, you have to look out for the dentist. And sometimes even when you are looking out for the dentist, they'll do something wrong and they'll still place the blame on you just because that's the way it goes. They don't want to place the blame on themselves because they can get sued. I don't know. I wish the dentist would personally acknowledge the stuff that they did instead of just like placing the blame on me, because it's not my fault that you did that wrong. And you know, when you work in the dental industry, dentists will get mad over the stupidest things. So literally, I swear, you'll be running around the practice covering up things because you know you just don't want to hear them trip. It'll be something like, oh my god, we don't have enough like nose cones or something, so you're gonna, you know what you're gonna do? No, you're not gonna go tell the dentist. You're gonna cavity wipe it and you're gonna put it in the room that you need it in, and then you're gonna go start the sterilizer, because trust me, you're gonna come to a point in your dental assistant career where you do not want to deal with the doctor's BS and their bitching. I swear to you. It's happened to me many times. And it comes to the point where like when you're first new at a practice, you're like, oh, I'll just go tell the dentist that this thing's wrong. Then you quickly learn. You do not go to the dentist for any problems. You figure that shit out because he's gonna be mad. At some practices, you straight up feel rushed. Like you barely have enough time with the patient, you barely have enough time to get anything done that you have planned that day, and it sucks. Because it's like, really, honestly, I'll be real. I don't think 30 minutes is enough to do a cleaning on a kid or an adult. I think you need at least 45 minutes to an hour. You have to do x-rays, you have to take their weight, height, bring them back. You have to do all this stuff, and it's not just like, okay, we're gonna bring you back and get you started. No, it's like, we gotta do 18 things before we get started. So, I don't know. I just feel like it feels like this like at a majority of practices, because a lot of practices want to see as many patients as possible so they can get that Monday, and yeah, it gets annoying because, I don't know, you're just in a constant state of go, 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 and never stopping. So, number 7, you come in contact with blood and saliva. So, that means that you come in contact with a lot of diseases, viruses and germs. I remember when I was in dental assistant school, they showed us this video and it still stuck with me. Maybe I'll insert a small clip or something here. And it's talking about if saliva were red. And then it's just showing like all the cross-contamination, the dental assistants, the dentist touching things, touching their face, and then like just, I have to say this because, okay, blood is not always red. Just because you do not see blood, just because you do not see red does not mean that there's not blood. Technically, your saliva is actually blood. Crazy. Google it. Come in contact with a lot of nasty stuff. You see a lot of nasty stuff, and I'm not gonna lie, sometimes you literally have people spit, fly in your face, fly in your hair. It's usually when you're not wearing a mask or goggles. I've done that a bunch. And especially working with kids, you learn. I do ortho as well, and sometimes when you're taking the little rubber bands off kids' teeth, literally food will fly off with the rubber band. It's nasty. So, okay. Number 8. This job is physically hard on your body. You're literally crouched over, looking into someone's mouth, suctioning, and like, it's a really physically demanding job. It's hard on your neck, it's hard on your back, and yeah, you're just like sitting there like over someone's teeth, looking in their mouth. It's, yeah. So I think if you don't get your back and neck treated on the regular, this is something that you probably can't do for the rest of your life. I can't even really give you a time frame on how long that you could do this because it really depends on your body and how fast you're breaking down your like muscles in your back and your neck. So I would say if you are into this type of job, try and work out some kind of trips to the massage parlor and just make sure you're taking care of your body and kind of reversing the damage that you're doing to it on the daily. This is random. I just thought I would say it. I didn't hear it in anybody else's video that I watched, but I don't know about you. I work with kids, so I literally have to hold the x-ray and just shoot right through it sometimes. And I recently just found out whenever you're taking a pano, you're supposed to stand 7 feet away, not 6 feet, 7. I guess there's a little bit of debate whether 6 or 7, but on Google it says 7 feet. So make sure you're standing 7 feet away. Like, one thing my dentist always says, he's like, try not to stand too far away, you're gonna mess up this little cord. It's like, that cord can be replaced. My life cannot. And then the fact, if I lose my fingers, they cannot be replaced. So I'm standing 7 feet. So yeah. And I feel like this is probably more of one of those things where it's probably like if you're not using it properly, but in dental assistant school, my teacher actually got thyroid cancer, which is that thing right here. And I'd say, I don't know, for all your patients that come through, make sure you're putting the thyroid collar around and you're always putting the x-ray vest. Okay, so before the pandemic, the only thing I had to wear was like scrubs, glasses, and just like a regular mask. It didn't have to be an N95 mask. Now, after the pandemic, this is one thing that frustrates me with my job because everything's changed since the pandemic. Now we have to wear scrubs, glasses, a KN95 mask or an N95 mask, and then when we're seeing patients, a mask over that, and then we have to throw it away or switch it or sterilize it or whatever in between patients. And then you have to wear a face shield, we have to wear a big blue gown, and then also, oh yeah, scrub cap. Is kind of growing on me because it's kind of nice whenever you're doing a cleaning and spit flies all over your face shield everywhere else and it doesn't get in your hair. So kind of liking that, but everything else is just really annoying. Like the gown feels like a trash bag. It even sounds like one. And it gets super hot at work. Like I'm sweating like all day. And they require us now to change out of our scrubs when we get off work. Before we could just leave in them, which it kind of makes sense because you literally have nasty stuff all over your scrubs then you're just transferring it to your car. It's better that way that they make you change, honestly. It's kind of inconvenient, but it's not too big of a deal. It is physically and mentally tiring. Like, you literally do everything. You're the dentist right-hand person. I feel like this one is one of those things where it's kind of hard to understand or kind of hard to explain. Okay, like for example, what I wrote down. For mentally exhausting, like literally, you'll go through the schedule for the day, you'll have everything planned out, and then say that patient comes in. The doctor wants to change every single thing about what he has treatment planned. It's like, why? I literally have everything set up already, and you want to change the whole treatment. And then just knowing like you have to come back to this the next day. People depend on you. People need you. Right now in my practice, my coworker's pregnant, so I have to do all the x-rays, and she calls in a lot. I'm not gonna lie. It's whatever. So I feel like I can't call in even if I'm sick because they need me there. Who else is gonna do the x-rays? Who else is gonna do this and that? But I do know if I was in too bad of a state of health, then I would just call in and be like, nah, I can't, because I can't be throwing up all over. Physically, by the time you're over, by the end of the day, you're like so tired. You're literally constantly moving at work. Sometimes you don't even have enough time to go to the restroom. Who knows though? Maybe you may work at a practice that's not as busy, but that's my situation. It's just physically and mentally tiring, like overall. I've been trying to work on making more YouTube videos, but it's like by the time I get off work, I'm so tired from working and just like drained, and I don't want to do makeup. I don't want to do anything. I just want to go to sleep, literally. So forward to that. I would just say try to do something in your free time that helps you grow separately from dental assisting. You need to keep your sanity. Sometimes you and your coworkers may just not get along. You may just not really vibe with the people that you work with, and it may honestly take you working at a few offices to find where you really really fit in, and that was my situation. It took me like working at 3 different offices before I found the one that I really actually enjoyed and liked. And it makes a big difference because literally when I was working at the practice that just treated me like crap, it was really taking a toll on me. Like I was having nightmares every night. I was like waking up crying because I didn't want to go to work. And I don't know, when people treat you like you're nothing, it really takes a toll on you, and it did for me. You have a risk of exposure to getting diseases and stuff. I kind of went into this earlier, but this is a little bit different. The risk is from needle sticks and getting stuck with sharp tools. Usually when this happens, if you do get stabbed with a needle or a tool that was used with a patient, if it was a clean tool, it's no big deal. You just put it back in the sterilizer and clean it. But if you get stabbed with a tool that was used on a patient, then, or a needle, the doctor will pay for it. They will send you and the patient to the hospital. They'll do a blood test, they'll test you, drug test you. They'll make sure that you didn't get any diseases, viruses, or anything like that from the person. So you do a lot of work. You literally do majority of everything at the office besides scheduling the appointments and getting the physical cavity out of the tooth. Like, okay, you set up the room, bring the patient back, get them ready, get the dentist in the room, start the treatment, start to clean the room after you're done. You sterilize the tools, you set up the room for the next day. And who takes home all that sweet money? Well, you guessed it right. The dentist, baby. We don't get paid that much. We didn't go to 8 years of school. But yeah. And I mean, they went to a lot more schooling though, so they kind of deserve it. But whenever I looked up dental hygienist, it said that they like start out at $78 an hour or something. I'm like, dang! Alright y'all, well that's it for today's video. I actually have to head out to work. The next video will most likely be how much I get paid as a dental assistant, because I don't know, it seems like that's something that people would like to know, and I don't think money should be so cliche that you don't talk about it. I remember when I first started, I thought I was going to start out by getting $15 an hour as a dental assistant, and I was wrong. Well anyways, if you enjoyed the video, please give it a big thumbs up, hit the subscribe button. The store where she called in, and it was full of treatment. It was terrible, and we got out late as fuck. I left after the cleaning lady that day. I'm like, this is not supposed to happen.